My background starts quite a long time ago. I was a very young student nurse at the age of 18. I did my training in Bristol, for 3 years spent there. It was strange really because I wasn't really sure why I went into nursing. Just seemed like a good idea at the time, and unfortunately I hadn't even really experienced a sick hamster, let alone anything else. So it did take me a little while to understand what nursing was supposed to be about. And I think my tutors took pity on me and they said, well, okay, let's give her one more chance. Let's put her into elderly care and see how she manages there. And I can honestly say at that point the penny dropped and I thought, this is what I'm supposed to be doing. So I stayed within elderly care as it was called then. I moved up to the Midlands and spent 10 years working in the accident and emergency department of a major trauma centre, which I loved. But within that time, I was really focused around the experience of the older adult coming through the service, because very often they were on their own, or they had dementia, or they had a really nasty fracture like a fractured hip. And they were very often very isolated, very dependent on us. And I didn't think that their experience was as good as it could have been. So we did a lot of work around older adults coming through emergency care. I spent 6 years at Keele University lecturing. I specialised in older adults and my master's degree is in older adults. And then I was very lucky to be able to move to the University Hospital of North Midlands within the NHS, where I was the matron for the older adult services. After I'd done that for a few years, I then became the Associate Chief Nurse for a couple of years, and following that I was very lucky to be successful to become the Director of Nursing for Brighterkind, and that spans 25 years.